And as a first question, I'm really keen to know, how did you get into nutrition? Because you're a sports physician, but your public talks are mainly about nutrition. So when did you start showing interest in nutrition, and why? Did you study any extra nutritional courses or anything like that?
Well, I think the blame for that has to rest at the feet of Professor Peter Bruckner and Professor Tim Noakes. So, as you know, they're both highly regarded sports medicine physicians, and they wrote an article in the British Journal of Sports Medicine some time ago now, probably 15 or more years, about 15 years ago, I suspect, and that talked about the management of diabetes and low-carb diets and high-fat diets and so on and so forth. And I was a junior doctor then. I was quite diligent, and I had the medical journals there, and I was reading it on the couch one night, and I saw this article, and I thought, wow, well, that's nonsense. I mean, I've gone to medical school, and I know how bad fat is, and I know that carbohydrates are good, and this just doesn't make any sense. So I said, that can't be right. And then I went and had a look at some of the references, and because I knew Peter Bruckner and Tim Noakes, and I understood they had immaculate credentials in terms of their academic prowess and being evidence-based on and so forth. So I probably didn't dismiss it quite as readily as I might have if I didn't actually respect those two authors. And I went to the references, and I was like, oh, and I started thinking to myself, there might even be something in this. This is quite odd. And understand that this was really quite confronting, because I thought I knew everything about, you know, cholesterol and fat and so on and so forth, and that just really opened my eyes. So over the next few years, you know, I sort of just continued this exploration. I read Gary Taub's book, Good Calories, Bad Calories, so on and so forth, and then I did a lot of literature searching myself, and just over the next several years, I guess I developed just increasing awareness of the importance of diet, and the fact that what I thought I had been told was actually not true. So I remember when I was a resident, there was this lecture by Robert Lustig called Sugar, the Bitter Truth. And at that time, it had had like maybe 2 million views, which is probably over 15 or 20 million views now, however many. But back then, that was a lot of views. And it even got a mention in a New Scientist article that I was reading. And I remember on night shift with some other residents, we were sitting there watching this 2-odd-hour lecture on all forms of liver biochemistry and so on and so forth, and we were absolutely flabbergasted to say, well, maybe all of these things, fatty liver and so on and so forth, maybe it's the sugar. And that was just part of the journey, and over time I sort of it influenced my practice. I still remember when I was on a general practice rotation, which is like family medicine, and a mother came in with her children, and the child was sipping a 600 ml bottle of Coca-Cola. We called them the Buddy Cokes back then. That was some time ago. And I made some comment, because in my new knowledge about sugar, I was like, probably along the lines of, I wouldn't be doing that if I was you. You know how bad that is. And rather than getting upset, the mother was incredibly grateful, because she actually had, I think, an instinctual awareness that her kid having that sugary drink was not good for the child. So she actually made him put the cap back on it and drop it in the bin right in the room. And she was really pleased with that. And I think that was quite a meaningful thing to me, because I actually felt that whatever the consultation was that day, that I had probably done more for that child's well-being across their lifespan with that small intervention. And it really struck me how simple it was and how powerful that intervention could be. And obviously my knowledge has expanded many-fold since then, over the last 10 or 15 years, and I've just been constantly learning and reading. But that was really how I got into it in a professional sense. That was really what gave me visibility that these things could be useful. And certainly from a personal perspective, it transformed my own health. I mean, I used to be having what was technically termed metabolic syndrome. And I'd like to think now that, 10, 15 years later, that I'm in much better health than I ever was when I was in my 20s and 30s. And so it's been a benefit to me both professionally and personally.